Mitä kaikkea potilaan tulisi hammaslääkäriltä odottaa?
What you are expecting from a dentist would be to make sure that your mouth, the oral tissue, and your facial tissue which is surrounding the mouth are healthy, and also to make sure that that there is no pathology in the mouth. And also, people who have already a problem would expect to be solved. So people can come with an infection or a malignancy, or people can come with broken teeth. You can have people without any teeth who can't eat proper food. So a dentist should be able to evaluate the person and recommend the correct path of treatment. And it starts by a good examination, thorough examination, and a good history of the patient, of general conditions, all these informations and the appearance. So basically what we do with many patients is that we start with the basic exam, and then we outline the deformities or the problems, and then we address each one at a time. Basically, in my clinic, I would start with the periodontal disease and infections first, and once the infections are sorted out, then we go in for reconstruction. And so basically the patient would expect to be healthy and then after the treatment. No one wants to be unhealthy after visiting a dentist or a doctor.
Minkälaisia hoitoja tarjoat?
The treatment modalities which I offer, it's a wide range actually. I treat patients with all the treatments available today in the world actually, because I have always studied based on what the patients need. So as I have almost 30-year experience in dentistry, I have studied preventative methods, and I have done most of the reconstructive methods and surgery, orthodontics. So any branch of dentistry which a patient needs, I could treat it basically with these hands.
Kuinka paljon sinulla on kokemusta hammaslääkärinä?
Amount of experience I have as a dentist. Actually, I graduated in 1988 as a dentist in Africa, in Sudan, from Khartoum University. Since then, I've moved to Finland and studied also in Turku University and in Tampere University. Then I've studied actually also in the Helsinki University. I have done research there. And also I went to Sri Lanka back again to study cancer. And I used to run a very large cancer research organization where I was the leader who did the groundwork for them, and I was in charge of training doctors to take biopsies and identifying lesions, and then also to bringing them to the hospital. And so it's a wide range of experience I have. I also have worked in England for 13 years, where I actually worked for the health center for 6 years, where I studied the National Health Service there. So their problems were different, their approach was different, problems with patients had was different, and so it's a multitude of experiences I have from the National Health Service. Then I had my own private practice in England for also 6 years, where we did advanced dentistry for reconstruction. So that was one experience. During that time, I was also traveling to Switzerland, studying under Professor Seiler, who is one of the most knowledgeable people in dentistry today. Even today, many people consult him, so I have quite a good backup. And orthodontics, I've been studying mostly with the Gothenburg University students, who the similar kind of ideology, where few colleagues have been supporting me for nearly now since 2006 actually. I have been studying with them the current technologies. So I would say that the experience comes from many parts, and each country has its own specificity, specific areas of development. For instance, Sri Lanka has a lot of cleft palate and cancer surgeries, so you can learn a lot of those areas. Finland has different specialities. When I came here, Finland was number one in prevention, and I did learn a lot in 80s when I came here. about preventative treatments. So all these knowledges collectively is my experience. So I would say that I could pass this information to other colleagues as well as to the patients who need such help.
Kenelle klinikka on sopiva?
My clinic, whom should come to my clinic, to my treatments? I think that anyone should be able to come to me because I am a general dentist who has studied all the specialty fields on my own. So as a general dentist, I think that anybody who wants to see that the mouth is in good shape and to get a good diagnosis, I think that would be a good place to come to my clinic. Age is not a matter because we treat infants right up to the geriatric patients who are very, very old and who needs a different type of approach. As I've worked in hospitals as well as in schools and many different areas of dentistry, I could help most people who come to my clinic.